This slide's presentation will cover various neuroanatomical levels of function, and this is really important to understand when you're working with patients that have had a brain injury.
There are at least 4 known neuroanatomical levels of function, and some people think that there could possibly be 5. The first level is simply a state of alertness to internal and external environments. An example of a patient that would not have this level of alertness is someone in a coma, and we'll talk a whole lot more about patients in coma when we get into brain injury. The structures involved in this level of function are the brain stem, specifically the reticular activating system, and ascending pathways to the thalamus, the limbic system, and the cerebral cortex. The second neuroanatomical level of function deals with subconscious drives and innate survival instincts. Example of these subconscious drives would be the drive for hunger and thirst, as well as reproduction. Level 2 also deals with learning and memory. The structures involved in this level of function are the hypothalamus and the closely associated limbic structures. The third neuroanatomical level of function deals with abstract conceptualization of verbal or quantitative entities. The main structure involved in this level of function in the brain is the cerebral cortex. It is because of this level of function that many patients who've had a stroke and or a brain injury will have difficulty with verbalization and understanding abstract concepts. The fourth neuroanatomical level of function deals with social expression in behavior, personality, and lifestyle. The brain structures involved in this level of function is the frontal lobe. Examples of patients that can have effects in this level of function would be patients with Alzheimer's, patients who've had a stroke, and again, patients who've sustained a brain injury. And finally, the fifth possible level of function would be the link between hard science and many unexplained medical phenomena, as well as the connection between your beliefs, emotions, and health with homeostasis. Not sure if this is a real level of function or not, but an example would be the 90-year-old grandma that is able to pick up a car that just rolled over her grandchild. Or another example would be that's well known that patients in the hospital that have a lot of family support, no matter how medically bad off they are going to do much better and have a much better prognosis overall than patients who have no social support. There's something about the mind-body connection that's very important, and some people insist that this is indeed another level of function. There is, however, no known structure in the brain associated with this level of function. The most important thing to remember about all of these levels of function is that with any central nervous system injury, particularly brain injury, insult at any of the levels can result in all of the levels being affected.